Okay, we're recording.
Great, I'll get started then. My name's James Pepper. I'm the chair of the Vermont Cannabis Control Board. Today is Wednesday, August 3rd, 2022, and I call this meeting to order. Just wanted to say that we were off last week. Feels like an eternity, but we're back. A lot has happened. Most importantly, we have onboarded our compliance team. So we had over 100 people apply for these positions, and there was so many talented people that we had to turn down. However, the good news is that the 4 that accepted plus Carrie really are the best of the best. And they're going to start doing site inspections later this week. So I thought I would take a few minutes now to introduce them and allow everyone watching to really just kind of match a face with a name, because these people will be kind of contacting you about site visits. Carrie, I'd like to, if you're there, kind of turn things over to you to introduce the team. But I did just want to very publicly thank you for accepting this role. For 30 years, you were a pillar at AG, the Agency of Agriculture. And I'm sure it wasn't easy saying goodbye to those folks. But if we're going to get this right, if we're going to kind of honor Vermont's reputation for quality, you're the right person for this job. So thank you, and I'll turn things over to you.
Well, thank you, James. No, I really appreciate it. It's been really fun thinking about how to operate in this space, what the market can look like, and bringing on the compliance team this week has me really excited. We've got a deep bench as far as compliance goes. A lot of experience either working in state systems and a lot of knowledge about cannabis as well. The first one I'd like to introduce is Chipper Sullivan. He's in Brattleboro. Chipper, if you can turn your camera on, that would be great. And this is Chipper Sullivan. He's down in Brattleboro. He's a long time produce farm experience, as well as experience in one of the larger dispensaries, working in one of the larger dispensaries in Mass. And welcome, Chipper. He's located in Brattleboro and will likely be covering the lower half of the state. Chipper, if you want to say hello, that would be great.
Hello, I am Chipper Sullivan. It's all true. It wasn't a dispensary as much as it was a Tier 11 outdoor grow. Yeah, and my experience in Massachusetts left me with an undying dedication to do it right in Vermont, because I have lots of criticisms of their system. So I'm looking forward to getting off the ground and getting things going here in Vermont.
Thanks, Chipper. And I apologize, I did know it was a grow, so there's a lot of grow experience there. And we're really happy to have you on board representing the Vermont field boots on the ground, the face of the control board out in the field.
Yep, it's great to be here.
Next person I'd like to introduce is probably a name that a lot of folks will recognize. She's been working in hemp space as well as teaching the cannabis class at both VTC and Castleton. Chris, you're up. This is Chris Monica. She's our next compliance officer I'd like you folks to meet.
Hi, I'm super happy to be part of this effort and excited to start getting out there and meeting the license holders. So yeah, I it looks like I might head up towards the kingdom. So anybody who's up that way should be seeing me soon. And just happy to be on board and moving forward with a great industry. So.
And anybody who started growing cannabis in Vermont in hemp space we'll recognize the next individual. Mike DiTomaso is currently at the Agency of Ag, but as the hemp program transitions over from the Agency of Ag, split between USDA and product regulation here at the control board, you'll all be familiar with Mike DiTomaso. Here's
Hey, I'm Mike DiTomaso, super excited to be here. As Carrie mentioned, I'm still with the Agency of Agriculture, but will be starting full-time for the board on August 15th. As Carrie mentioned again, I've been working with hemp growers and processors in Vermont for the past 4 years or so, and I'm really excited to be carrying on that relationship with a lot of the folks that will be also entering the cannabis space. Thanks, and looking forward to meeting you out in the field.
Our last hire that's starting Monday. She's really shined as someone who's going to help us navigate the state system. Experience at the Department or Agency of Human Services, Department of Aging and Independent Living. We've brought on Denise McCarty, and I'm gonna have Denise say hello.
Everybody, I'm Denise McCarty, and I'm really looking forward to doing this very important work. So I will be seeing many of you. It looks like I'll be covering Washington, Memorial, and Chittenden counties or so. So I'll see you out there. Thank you so much. Take care.
And that's the team currently. We will be starting field visits. They've been out this morning, but those are starting this week and into next week. We'll see you all out there. Thank you. And thanks.
Thanks, Gary. And thanks to everyone. Really, I mean, it's such an exciting time in Vermont, and I couldn't be happier with the kind of everyone's enthusiasm to get going and really do this right here in Vermont. So thank you to everyone on the Vermont side.
Super exciting.
Very exciting, yeah.
Just a quick update on licensing. So it is August 3rd. We don't have any product manufacturers ready to go for this week. We're still trying our best to make it through kind of our outdoors and cultivation licenses, but we are moving on to the product manufacturers and wholesalers. So we should have some of those soon. Also, our application portal is ready for retail. We decided to go ahead and open that. So if you are a prospective retailer, our portal is live. You can access it through our website at ccb.vermont.gov/forms. And there's a link there to access our application portal. And you'll see now that there is a way to apply for retail licenses. So that's great. We really want to kind of get those applications in and start their review as soon as we can. With respect to outdoor cultivators, I mentioned something at our last meeting that generated a few questions. So I figured I'd just revisit it and see if I can clear up some of the confusion. If you have a pending application for an outdoor or a mixed tier cultivation license, the board emailed you a letter asking if you still want us to process your application this year. We know that at this point in the summer, if you don't have your plants in vegetation or in the ground, you're probably not going to get a full harvest. If you are in this situation and it doesn't look like you're going to plant or harvest this year, the board really doesn't want you to have to pay for a license that you're not going to get the full benefit of. We don't want you to have to pay for insurance or banking services that if you're not actually going to operate this year. On the other hand, I'm sure there are people in this situation that do want their license. Maybe you want to get your operation ready to go for the spring and you want to do that on your own timeline. So really us sending out this letter did not suspend or pause our review of your application. You don't have to take any action if you want us to continue to process your application. But if you do want to pause, there are instructions in the letter on how to communicate that to the board. We'll be in touch with you if you do communicate that to the board that you want to pause. And we'll be able to talk you through kind of what the next steps are and, you know, some of the things like banking and insurance requirements that you can kind of waive in this interim period. Just a general point also that email is always the best and most efficient way to communicate with us. Our staff is very responsive over email, and it's always the easiest way for us to provide clear answers to your questions. So please try to prioritize email when communicating with the board. It just speeds everything up on our ends. The medical program, we're in the process of developing our legislative proposals for the medical program. We wanted to start by asking the public to share their thoughts with us. To that end, we're going to be holding 2 roundtable discussions next week, one on Wednesday, August 10th at 2 p.m. right after our board meeting, and then one the following day on Thursday, August 11th at 6 p.m. We'll have some directed questions we'd like to ask the public, members of the public, but this will be an open-ended discussion about the future of the medical program. So if you care about the medical program, if you're a current or former patient, if you're a caregiver, if you're a healthcare provider, if you're someone who has not been able to access the medical program or it's been unaffordable, or if you just want to listen, please join those roundtables and share your thoughts with us. These will be fully remote, and the links to participate will be either by phone or by video will be available on our website, and we'll get those up as soon as we can. But they're next Wednesday and next Thursday. Just wanted to talk quickly about the tobacco product tax, sometimes just referred to as the vape tax. I think it's clear at this point that despite whatever the legislative intent or the logic of this tax, it is going to apply to cannabis vaping devices and cannabis products, whether they have any tobacco in them or not. I want to be clear that, you know, everything that we've learned about EVALI, you know, the CCB thinks that leaving this tax in place is dangerous. And we're going to ask the legislature to exempt THC products from this tax. However, until that happens, anyone who intends to retail these products will need to comply with the law, including getting a tobacco retailer license from the Department of Liquor and Lottery. The tax department has developed guidance on how to comply with the requirements of the tobacco tax. They updated their kind of guidance document. It's on page 8. And we have a link to it on our website, and they have it posted on their website as well. A quick note on inventory tracking. We've made significant progress on getting our inventory tracking system up and running. I want to wait just a little bit longer until we have contracts in place before I go into the specifics. But just a 30,000-foot view, licensees are going to have reporting requirements that they're going to submit to the board at regular intervals about their inventory. And we will be analyzing those data sets with the help of a third-party analytics contractor for aberrations and suspicious activity, and they're going to help prioritize our enforcement actions. So we'll have more on this very soon, but we're just kind of in the process of getting contracts signed. So other than that, just need to approve the minutes from our last meeting on July 20th. Do you guys have a chance to review those?
Yep.
Is there a motion?
Seconded.
All in favor?
Aye.
Aye. All right, so moving down the agenda, you know, we are required to develop a point of sale flyer with kind of information for consumers that gets handed out by retailers at the point of sale. Not a lot of information can fit on just a little warning label. And so this is a way to kind of provide additional information to consumers at the point of sale. Julie took the lead on developing this. She had kind of a robust process of stakeholder input. You have a draft of it,
I do.
and thought it might be helpful to kind of review that now.
Sure. Just to do a little table setting reminder and leaping off from where you started, the requirement in the legislation is that the retailers hand it out or offer it at the point of sale. And then we would have it posted on our website. And the legislature had some requirements for the content as well, to include methods of consumption and the time it would take for a product to take effect, where folks might seek help if they're having issues with substance misuse and so forth. So with that in mind, then the other key component is that they required that we consult with the Department of Health, which we did. And so to keep in mind when I share the draft that the target audience for this flyer is essentially someone who has already gone into a cannabis establishment and is at the point of purchase, and is perhaps someone who has not purchased cannabis before or is not a regular consumer. So it's got a lot of very basic information for that reason, because our, guiding principles that led off from our mission were about consumer education and harm reduction. And so that is really sort of the goal I took with this. So we got input from the Department of Health. We did consult with them. I also consulted with the prevention community and our appointee on the advisory committee, who is in the Agency of Health and Human Services. So specifically sought out folks who have experience communicating public health information, harm reduction information, and prevention and consumer education information. And we also got lots of public comments, particularly back during the period of time that we were doing the subcommittee meetings with the public health subcommittee. There was conversation about this, so I went back to those conversations as well. And other states have similar things either on their websites or in their stores, so we looked at those as well. So with that, I will share the draft. Okay. So also just a reminder, this is the text only. So any sort of formatting or, branding or logos that would be on it are not necessarily in here. I thought it was sort of important to get the text right first. So it starts off talking about, sorry, I'm just trying to find the way to navigate here. It starts off sort of discussing the difference between THC and CBD. It seems like there is confusion among some of the broader community about what those two things are and what they do and their effects on the body. Then it goes into some of the legalities, 21 plus only, unless you have a medical marijuana card, no public use, prohibited on public lands. It talks about the dangers of driving under the influence, which was one of the legislative requirements. How do I navigate down?
There it is.
There we go. I don't know how you edited the rules like this, David. I struggle with this. Okay, so it talks about driving under the influence and the dangers there, again, legislative requirement. And then one of the other legislative requirements is a notice that it is still federally illegal. So what's bought in Vermont must remain in Vermont is geared towards that. And then from there, it really talks about safety and safe consumption. So talking about everyone's experience being different, starting low and going slow. We got some feedback about being a little bit more specific about the type of dosage that someone should start with. So we added that as well, and a little conversation about potency. There we go.
You're going slow. You know
That's
what I mean?
okay.
Starting
We're
low,
gonna
going
go,
slow.
we're starting low, we're going slow, we're gonna go through it. So talking about potency, that potency matters, that certain products like edibles may take longer to take effect. And then you can see in each of these, it talks a little bit about like a starting dosage and a wait time before taking another dose. For edibles, for vaping, for concentrates, commonly known as dabs, and for smokable flower. Then a little bit of a warning about not mixing cannabis with other substances, particularly if you're not a regular consumer. And a notice that cannabis is not for everyone. There are some folks who have good experiences with cannabis and some folks don't. So here's where someone would find information if they're struggling, they or someone they know is struggling with an issue with misuse. And then also, if they are having psychosis or suicidal thoughts, the National Suicide Prevention Hotline is listed here as well. And then for signs of overuse, there's a little sentence or two about that, but most importantly, the Poison Center, who I also spoke with about this, they asked us to put the number in the flyer, which we did, and they provided us with some logos to add when the time comes to do that. But they also have experience speaking with people who have consumed too much and being able to guide them and help them in the moment. Then there's a warning about what to do, cannabis and youth brain development, and that it's not suited for people under 21, and that the brain does not finish developing until 25. So some of this information is added, not just because, I mean, there wouldn't be a youth in a retail location to receive this flyer, but this will likely go home with a product that perhaps their parent or guardian purchases, and these are things that they should be thinking about when they have cannabis in their home. So then there's also information about accidental use to avoid while pregnant or caring for children, and to keep locked and out of sight and out of reach of children, and how to do that. And that, and then some how to consume safely. Just a reminder for folks who might be using, or might be out doing recreational activities. If they don't consume cannabis, it may affect their response time. And to be careful, actually, this sort of came from Colorado, has a similar warning in their flyer, although there's a specific to skiing. And then to consult a healthcare provider if you have questions. So that's the content. I can show the logos and so forth that are front, like the Let's Talk Cannabis logo was provided to us by the Department of Health. The National or the New England Poison Center logo was provided to us, and some other prevention links that we can include in the final version of the flyer.
Thank you for taking the lead on this, Julie.
Yeah,
You're
I think it's
welcome.
great. Yeah, no, I mean, when you think about the intended audience, these are kind of the things that, these are the things I think people need to know. So,
And I think it's important to remember that the preface that you said at the beginning, these are folks that are at the point of sale, ready to, do a transaction.
Yeah.
And it's just helping for the folks that may be doing this their first time or first couple times, and, have no prior experience, just the things that they should think about, should it not be the experience that, they may think it is.
Right. One other thing I should mention too is that this should be seen as kind of part of a multi-layered approach to harm reduction and consumer education, because we also have required education for our retailers, and other agencies and other entities also do consumer education. There will be responsible retailers that are doing, or establishments that care a lot about educating the public as well. So this is really part of a multi-layered approach.
right. And also there's the investment of the excise tax
Yeah.
towards youth prevention education
right.
as well. Yeah, no, I think this is great. I had just a few little, very small comments, but I don't know if it makes sense to do them here or not. Because they really are just kind of like little like stylistic things. It almost makes sense. I feel like I'm gonna just send them to Bryn because they don't change the substance at all of the
Okay.
document. So I could do it that way instead of kind of editing it here. But just from a process standpoint, it seems like whatever kind of final draft that we come up with should just get one more review by
Sure.
Department of Health. Just get their final sign off on it because, I mean, I don't feel qualified to kind of be the person to just say this is the right messaging or this is the right message. This is the right message. So, we have to rely on their expertise. They've
That's right.
been doing this for years in other areas. So, great. All right. Let's move on then. I know we got a comment last week about kind of doing another categorical exemption 2 weeks ago. And I know, I asked you to kind of think it through whether it
Yeah.
makes sense. And so maybe you could just help us decide on that.
Yeah, so folks that were with us 2 weeks ago may remember that we did a categorical waiver for the rubber or plastic gasket or seal that's often found in glass jars with a screw top, whether that screw top is tin or wood or bamboo. At this time, we're not doing any categorical waivers for a plastic screw top. But what we did get a comment, we did 2 weeks ago approve 2 different rubber dropper tops for like tinctures and stuff like that. Point well taken in our comments that, one thing we're not trying to do is play to specific brands. At that point in time, we'd only gotten 2 waiver requests for that specific product. And the more we thought about it, I think it does make sense to extend that categorical waiver to those rubber tops that you use as a tincture bottle, because there just isn't a really good alternative to those. And again, we're not trying to play to specific brands, and this plastic ban language that we've put into our rules does create some unique situations where, we're trying to focus on the substance, not the specific brand, but the specific brand does carry some weight into what we're doing. But, there's not a lot, these can be found in so many different places from so many different vendors that, we think that it's the best course of action to take.
Yeah, great. So I think the best, are you all right with that, Julie?
Oh, yes,
Yeah,
that's fine.
okay.
And that's all, like any rubber stopper top is categorically waived, right?
Exactly.
So I think it might make sense for us to put up a few examples on our product registration waiver requests, kind of.
Yeah, well, I'll work with Nelly on that. And those 2 that have been approved.
Yeah.
And we can, I don't want to highlight specific brands, but maybe we can put a picture up or something so
Yeah.
folks know exactly what we're talking about.
Right.
I will say that I haven't gotten, I think we've only gotten 1 new request since we went in this direction 2 weeks ago, which is encouraging. We are still considering some of the waivers that have been submitted, but we really want to encourage glass with these specific tops. I think if we're thinking about, we opened retail windows today, and if we're thinking about retail establishments that are going to take advantage of our take back and reuse programs, this is going to be the best way for them to create a sanitation plan and using these specific types of packaging to really take full advantage of that. So that's where we're at right now.
All right. Well, why don't we move on then? Next on the agenda, review of staff recommendations for social equity status and license applications.
Okay. Here we have your adult use and medical register for this week. There are a couple things that look a little bit different about this register, so it should be pretty easy to navigate though. And I'll point out anything that needs to be clarified. So starting out with the medical cannabis program, some numbers from the last 2 weeks. 35 new patient applications, 98 renewal applications received, 181 patient cards were issued, 8 caregiver applications were received, and 4 renewals were received, and 7 were approved. 7 applications for caregivers were approved, and 22 dispensary employee ID cards were issued. And an update, the medical staff are processing applications received on and after July 12th. We have a final report on our pre-qualification approvals that just breaks it down by the application type. So you can see in total, we issued 222 pre-qualifications. No new ones. Just a reminder, the pre-qualification window has closed for now. But this is what our breakdown looks like for pre-qualification. So I know you've seen these numbers before, but it's just a little bit more distilled to get a sense of what's coming. So I'll move on to our license applications. These numbers are up to date as of yesterday. You'll see in our table here, we have a new row here for employee ID cards. That will probably be a separate table next time. But you can see we've got 37 employee ID card applications in process right now. None have been issued as of yet, but a reminder that you are able to get a temporary employee ID card until your permanent application has been processed. So we'll break that out for next week. This week we have, you can't really fit it all on the screen, but we've got 20 applications up for board approval for a license this week. They are all cultivation applications still. As the chair mentioned at the outset, we don't have any manufacturing or wholesaler applications up for a license just yet, but they are in review, and hopefully soon we will have some ready for licensure. So I'll move down to our list for recommendations for a license. The 20 businesses that staff are recommending for a license have all demonstrated compliance with the requirements set out in board rule and in statute. So I'll just go through the list. We've got Burning Bush Farm, an outdoor tier 1 cultivator. Island Pond Cannabis Company, a mixed tier 1 cultivator. Flavorline Cannabis Company, a mixed tier 1 cultivator. Trombley House of Cannabis, a mixed tier 1 cultivator. 7 Bees Farm, a mixed tier 1 small cultivator. Z's Green Z, a mixed tier 1 small cultivator. Hidden Valley Farm, a mixed tier 1 small cultivator. Dalen Ltd, a mixed tier 1 cultivator. Overton's View Farm, mixed tier 1 cultivator. Maple Buckets LLC, outdoor tier 3 cultivator. Lagamont Breeds LLC, mixed tier 1 cultivator. Fox and Hen Farms, outdoor tier 1 cultivator. Moonlit Gardens, an outdoor tier 1 cultivator. Vermont Green Buds LLC, outdoor tier 1 cultivator. Green Mountain Gold Farm, outdoor tier 1 cultivator. Cannabis Collective, outdoor tier 2 cultivator. Faustini Farms, a mixed tier 2 cultivator. Love Spun Farmstead, an outdoor tier 1 cultivator. Orleans Cannabis, a mixed tier 1 cultivator. And Honey Tree Farm, a mixed tier 1 cultivator. So that is your list up for approval this week. I'll move on to social equity numbers for this week. We don't have any social equity applicants that are up for approval for a license this week, but we do have 6 applicants who are up for social equity status this week. And those are submission 529. Staff are recommending social equity status for this applicant because they meet the criteria for a social equity business applicant. Submission 191 also meets the criteria for social equity business applicant. Submission 286 meets the criteria for social equity business applicant. Submission 846 meets the criteria for social equity individual applicant. Submission 852 meets the criteria for social equity individual applicant. And submission 1000 meets the criteria for a social equity business applicant. So staff is recommending that the board grant social equity status to those 6 submission numbers. The staff is recommending social equity status denial for 2 submission numbers, and that's submission 380 and 695. Neither of these submissions meet the criteria for social equity individual applicant as defined in board rule.
Any questions for Bryn? Nope. All right, is there a motion to approve the staff recommendations?
I move that the board accept each of the recommendations for social equity status and licensing approval as presented to us by staff in this meeting.
I will second. Any discussion about any of these? No? All right, all in favor?
Aye.
Aye. Great. One thing that I haven't mentioned, but most people probably know, is that we have all of our approved licenses. You can kind of see them by category up on our website. We also have a nice map feature. We don't list the specific address of these cultivation sites, but you can see just what towns they're in. So it's actually a very good geographic distribution of the ones we've licensed so far. It's also
Corners of the state.
yeah. All right, so why don't we move to public comment? You've joined by the link. If you'd like to make a comment, please raise your virtual hand. We'll start with those kind of in the order that you've raised your hand, and then we'll move to anyone who's joined by a phone. And maybe Nellie, you could help us out with the order.
Absolutely. Dave is first.
Hey all, I want to share, first of all, thank you for the actions today. Great information, good progress. Very happy to see things, the retail application open, but I want to share a frustration that I'm getting from many of my clients regarding the CSI background check process. I know that you guys would prefer to do it a different way, and it was foisted on you because the FBI rejected you. And so, I think everyone gets that. But the CSI process, aside from being expensive, is occasionally very slow. And by the way, the results I'm seeing are sometimes not great. Like I've had a couple of clients who I know have criminal records because we pulled it for the pre-qual from the FBI background check, and CSI isn't even getting it. They're missing it. So, I think you're getting poor service levels from CSI in addition to the high cost and the frustrating process. But I think even more importantly, it is a drag on the application process. Currently, people are not being asked to start the CSI process until after some level of deep staff review. And I'm wondering whether there is any way for you guys to get people to start the CSI process even earlier, like when their application goes from submitted to received, because at least then they can get that started. And if CSI is taking 1, 2, 3, 4 weeks sometimes when it's complicated, at least you already have that back by the time the staff is doing the deep review and moves the application from received to either incomplete or whatever, that they have the background check so that there's not a 2-week pause or several week pause while waiting for CSI. So that's my suggestion to you in this CSI process that I know everyone I'm looking at on the screen here is frustrated by. So thank you.
Thanks, Dave.
Marie. Marie with
Marie.
Grow.
Marie, we can't hear you.
Can you guys hear me yet?
Yeah, we can hear you now.
Oh, okay, sorry, it was taking forever to unmute.
No problem.
Thank you again, as always, for what you do and how hard I'm sure you're all working, because I know it's got to be a very difficult process. But I have to echo what David just said. I'm in the process of, I have submitted my application for manufacturing tier 2. And what really worries me is the time frame, the crunch I'm going to be under, because I can't legally, go and purchase these products that I need to purchase to make my pre-rolls without the licensing through some organizations that I'm working with. The companies I'm working with want to see my license. And my biggest concern is, and I know this, you know, I guess I could just need to let you know what I'm dealing with is the time frame of when I get these products. If we're talking weeks for the CSI, we're talking weeks for me to be able to get my products to make, you know, the product that I'm going to produce. Then, yeah, we're looking at like past the going live date, and that really worries me because I want to be in on it. So just wanted to throw that out there. It's kind of scary. We're getting into crunch time, you know, from our perspective. So just wanted to share that.
Thanks, Marie. Appreciate the comment.
Kate.
Hi, this is Kate Burke from Grabell and Shea. I just had what I think is probably a pretty simple technical question. The application website is not the best. It tends to boot us out each time we log out. We have to reset passwords. And I was just wondering, for purposes of expediting, you know, collecting information for the application, I definitely understand and agree with you guys wanting the application submitted through the portal, but could you post a PDF of the application too, so people could just look at it with the understanding it has to be submitted through the portal, but so we could gather the info without fighting the website so much?
Thanks for the comment, Kate. Just so folks know, we don't generally answer questions directly during the public comment period. It would very quickly turn into kind of a just question and answer session. But we do collect these comments, we do consider them, and we do try and post comments or post guidance or around this, or just come back with an update at the next meeting as to some of the kind of suggestions or questions that we've received.
Keto.
Hi, everybody. Hopefully you're all having a great day. I want to second what Kate was saying. We had a technical problem over here too. The new link on the retail app just says access denied when we tried that. Next, I just want to talk about the disclosure of locations of licensees on the website. I just don't see an upside to that, and it's really concerning, and I hope that goes away. I think most, you know, obviously retailers want people to know where they're at, but I think I can safely speak for most growers that they definitely don't want people knowing where they are, and there's no reason for it. You know, the downsides are plenty, so I'd really like to see that go away. And lastly, that vape tax news, I'm glad to hear that the CCB is taking some action, but it's really disappointing to hear. It also doesn't really make sense that they're going to keep this for cannabis, yet the current dispensaries don't pay this tax now. It just doesn't make sense. So hopefully we can navigate through that issue, but that's it. Thank you.
Thanks, Tito.
Michael is next.
Hi, everyone. Thank you for all of the hard work that you guys have all been putting into this new industry. I work for an insurance agency out of Massachusetts and have firsthand seen the difficulties of our own state, and have been working pretty diligently with a number of applicants in Vermont as well. And one thing I wanted to comment on was the insurance requirements for Vermont operators, more specifically for home-based businesses. I actually have an exclusion up from one of the largest insurance providers for home insurance in Vermont that states no coverage is provided for bodily injury or property damage arising out of a business owned or financially controlled by the insured or a partnership of which the insured is a partner or member. Therefore, home insurance is not covering home-based businesses, whether it be a cultivation or product manufacturing operation. We are actively developing a new program that is a commercial insurance option for these new home-based businesses that does not have a residential exclusion. This should be online soon. Like I said, we've seen some pretty hard difficulties here in Massachusetts regarding insurance. I'd like to work with the board here on the insurance requirements to make the process a little bit more streamlined for these new home-based businesses, as well as the commercially located businesses as well. And from a risk management standpoint, I have to back what the last speaker just said about the locations of these operators. It does enforce a level of theft that could be concerning to insurance carriers getting into this new market. But otherwise, thank you so much for your time, and thank you for your hard work, and looking forward to more developments within the industry here soon.
Thank you.
Nate.
Thanks everyone for taking all of these public comments and for your time building this out. It's much appreciated. I just wanted to ask, with the moved up schedule to accept retail applications, if that also comes with any sort of moved up deadline to get those in. I didn't hear you reference anything like that. I just want to make absolutely sure that that wasn't you know, a stipulation or contingency with moving up the date to start accepting them, that you're moving up at some sort of date to stop accepting them. So that's all I had. Thank you.
Thanks, Nate.
Bobby.
Hi, thank you for taking my question and comments, and appreciate all the work you guys have done. I'm a social equity applicant, and I've been scrambling to get everything resubmitted. I did it last week. I sent an email. I sent 3 emails, 1 voicemail. I tried on the portal. My issue is the portal, application intake portal. It's very complicated. It shouldn't be complicated. There's a glitch somewhere, but I tried to resubmit, went back and looked through the work, review. Having said all that, I sent everything via email to make sure you got my information, but I haven't had any responses in the past week. And so Monday, brilliantly, I resubmitted and it took it. So I don't really know where my application is at this process, but it's been a long journey, and I feel like I need to create a support group for this process. I'm sure you need to, you feel like too. It's a lot of work for everybody. Thank you for getting us this far, but I still don't have any information, even though I was issued a license on the 17th. So I went back and did everything you asked. Is there any way I can find out where my application is at this point? Maybe a sidebar note. Is there anything else you need from me at this point? And I can, my application number is the S and then 60718. And my second question, yes, sir.
Yeah, go ahead.
My second question is, are cultivators also required to have a retail license for tobacco for the taxes as cultivators?
So Bobby, we don't, again, just generally answer questions directly during this public comment period. But we will have someone reach out to you about your application, and then the tax department is the one, and liquor control, that can answer questions about what's required from a tax compliance standpoint.
All right, I'll follow up with that. Thank you for reviewing my application again to make sure if there's anything missing.
Thanks, Bobby.
And thank you for all your work.
Jim.
Thank you. I really want to thank Ms. Hulbert for her openness and for reaching out when drafting the point of sale flyer. We really appreciate that, and we think you're making great progress. I'd like to ask that you post the draft that you discussed today on your website so we can all see the draft. And second, I'm hoping at some point the board will put on this agenda the proposed amendment to Rule 2.9 that we submitted on July 8th. Just to refresh your recollection, under Connecticut's approach, the state requires retailers to make best efforts to market low potency, low dose items. And we'd like to suggest 2.9 be amended to include that mandate in Vermont. Thanks.
Thank you, Jim.
Al.
Yeah. I have a quick comment. I just want to echo what I think it was Tito was the name, in terms of the location of cultivation spaces or facilities not being public record or at least easily accessible. That seems like an enormous issue to me, and I would definitely encourage you to take that really seriously and, bear in mind that the reason, to me, that's so important. It's not, a couple of teenagers that are going to come, try to snag a plant. If you follow any of what happens out west, it's a level of organization that's going to come and make sure they get all your plants in the best case scenario. So I would definitely implore you to do a little bit of research on what has happened in certain parts of California, specifically with the cartel targeting legal licensed grow operations. I don't think we experience the same level of organized crime in Vermont as somewhere like California with the cartel, but especially as one of the states that is legal with other states around it not being legal. It just seems like a total no-brainer to me.
Thanks, Al.
Jesse Lynn.
Thanks so much for having me. My name's Jessie Lynn Dolan. I'm a nurse and I don't get to attend these meetings very often, unfortunately, lately. So I want to just jump in and throw in a couple comments related to some of the things discussed today. When we talk about packaging, I will just continue to mention that I would love us to address and look at using different and more accepting, inclusive language than breastfeeding, because that is the theme and the norm today, to use more inclusive language when we're looking at that population. I wanted to ask if there's any information you guys can share along the lines of education and when or what you will be mandating and what that's going to look like for employees. I want to reiterate my support of Tito and reducing the taxation on vapes, and just let you guys know as a Cannabis Control Board, if you have not seen the new research, there is new research out showing even more detrimental effects just on the temperature that vapes are combusting at. So looking at that and again, deterring people from using those single-use cartridges, instead being able to purchase flower vaporizers without that increased taxation. I also want to reiterate, as a single female cannabis cultivator, it is very concerning for me to have my address publicly out there. It has brought concerns and issues to me before, and I know this has been brought up, but I will continue to support the other folks who are asking to look at possibly adjusting or looking, for more safety parameters around that. Last one or two things I just want to mention, because I know I don't think it's been talked about in a little bit, is some of the lab testing mandates. I will continue to mention and advocate for mandated terpene testing in our labs, because if we really are concerned about intoxication and the way cannabis affects us from that psychoactive perspective, we do need to be looking at the terpene testing. And if we want to support both patients and consumers to use both efficaciously and affordably, then terpene testing is where that education will support them. And lastly, just wanted to throw out there, and I know I'm throwing a lot of stuff at you, but you guys know me by now, it's kind of how I roll. Wanted to mention third-party certifications and programs like Clean Green and what that means and can mean to Vermont, and where that falls along pesticide testing and also the use of the word organic. We're seeing a lot of people out there posting things saying they're organic, and I know the USDA has different opinions and thoughts on the use of that word, so I just wanted to see if and when we'd have some guidance regarding both that and education. So thank you so much for everything.
Thanks, Jessie Lynn. So I don't see any other hands up. I'll move to folks that joined via the phone. If you joined by the phone and would like to make a public comment, you can unmute your phone by hitting *6. And of course, if you join by the link, just continue to, and you want to make a comment, please feel free to just raise your hand. Marie, we generally don't take repeat comments during these formats. But if you have a comment that you'd like to make, we have on our website just a portal where you can just kind of click on that button, submit a comment. It goes to every board member's inbox, so we will see it. And we'll have another public
Actually, just wondering, it's actually not a comment. I'm wondering if that insurance man is still on, because I've been having a heck of a time finding insurance. So I would appreciate if he's still there, if I could get his name again.
Well, our website, I mean, the video to this meeting will be posted on both YouTube and our website, linked on our website. So you can just kind of go back and watch it. And we do have a few insurance companies that have kind of reached out to us. It's not an endorsement of any of them, but have reached out to us and say we do insure cannabis businesses on our website. If there aren't any other public comments, then I'll close the public comment window. Thank you for the comments. Thank you for the concerns. Again, we try not to answer questions directly during these public comment sessions, but we do really appreciate the feedback, and we are constantly updating our processes, updating our guidance based upon what we're hearing from people kind of on the ground. So thank you for that. Just on the location of cultivators, I did want to touch on that. We are not posting physical addresses, span numbers. We're not posting any of that. We're posting just the town. And we have a kind of balancing act that we have to do with respect to the public records laws. And we're allowed to exempt, anything that might implicate public safety. We decided that the line there is the actual address, not the town. But we can always reconsider internally whether or not we need to be even more general with the information that we put out. It's a point that we have thought about and discussed here, and we can kind of continue to discuss.
Yeah, I think folks need to remember that these are public records. And yes, we are aware of what goes on in other states. But thank you.
Any other comments from Julie, Kyle, Bryn, David that we need to make before we adjourn?
Unless you have an objection, I'm comfortable adding chest feeding and human milk feeding to the flyer. I did a little research. I meant to mention this when I was talking about it, but
I saw it on your text of your flyer.
yeah, so I think we are going to add that if it's not already there.
Sure.
I may have added it already.
Saw it.
But yeah, so midwives are using that language, and a couple of state departments of health in other states.
Great. Right. If there's nothing else, I'll adjourn this meeting. We'll see everyone next week.